Meena, can we go ahead, Meena?
Yes, Karpagam.
Yes. Good evening and a warm welcome to all the delegates who have joined this webinar. This is an exclusive webinar because today is World Menstrual Hygiene Day. For time immemorial, talking about menstruation and periods has been a taboo in our society. To break the silence and break the stigma, the WHO has actually framed a World Menstrual Hygiene Day to create awareness about the myths, about to break the silence and shatter the myths about menstruation. We all know menstruation is a physiological process. Every female who's born in this world is supposed to have it, and there can be lots of changes, lots of abnormalities, lots of differences. This webinar is basically framed to understand the endocrine aspects of puberty and menstruation, and from an endocrinologist perspective, and also from a pediatrician's perspective, because most people will actually come to the pediatrician, general pediatrician, and then based on the evaluation, they'll be referred or treated. And the other aspect is what a public person or a school teacher or a parent would like to know and learn from us, how to tackle the problems they face on a day-to-day basis in schools, in society. So we also have a school teacher who's also a parent with us, who will be sharing her experiences and asking a few questions from us. And it's our responsibility as a people from the medical community, gynecologists, pediatricians, endocrinologists, to actually clarify their doubts so that everybody goes with the same frame of mind and we all speak the same language. Thank you so much, everyone, for joining this webinar. Next slide. Professor Dr. Sampath Kumari Madam is a very dynamic Oxy president. Unfortunately, Madam is unable to join due to bereavement in the family. So, Dr. Meena, who is a secretary of Oxy, will be delivering the welcome address. Dr. Meena is an extremely dynamic person, very humble, very down to earth, and very close friend of mine. She is secretary of Oxy, co-chair of Urogynec Committee of Oxy, and member of Urogynec Subcommittee of Oxy. At present, she is in Chengalpattu Medical College as associate professor. Meena, over to you for the welcome address and the Oxy prayer.
Thank you, Karpagam, for the kind introduction. So it's an immense pleasure to welcome everyone for our Oxy webinar on menstrual hygiene, as enthusiastically by our ever young Karpagambal Sairam, and energetic is not to only say about our academic excellence, about the marathon running as well, for conducting such a academic session back to back on 26th and 28th as well. So I welcome all the faculties and the delegates for this menstrual hygiene webinar. So starting with the prayer, Oxy prayer. Thank you, God. In humility we gather. In gratitude we pray for all the good things you have given us. Shower us with your blessings to pass on the healing touch, to celebrate the arrival of each new life and a mom reborn. The courage to deal with it all when things are not perfect, and to remember that we are but messengers to keep our women safe and free from sorrow. We bow before your kindness and the magnanimity of your endless love. Over to you, Karpagam, for smooth conduct of menopause hygiene webinar. And we have given the prize for the slogan and the posters yesterday, as we had the clinical meeting in person. It was well attended to, both the slogan and the poster. Over to you, Karpagam, to take over the proceedings.
Thank you so much, Meena. So actually, we had a slogan and poster contest for the World Menstrual Hygiene Day. We have a lot of registrations, and we selected the winners, and the prizes were given yesterday in the Oxy clinical meeting. But at the end of this session, also we'll be announcing the winners. So myself, I am Dr. Karpagambal Sairam. I'm basically very passionate about obstetrics, gynecology, and anything related to women's health and And if when actually blame hormones for anything, I blame them, because hormones are what we are. We live in harmony with hormones, and we are the happiest species on earth. So very passionate about hormones and periods and pregnancy, menopause. So in case you have any negativity about them, please feel free to ask any questions. We'll break all your negativity and we'll live happily with the hormones. Next slide. So the first talk is breaking the silence and breaking the stigma. So basically, we all know, I will be sharing my screen now, my slides now. So can you see my slides?
Yes, ma'am.
Yeah. So basically, why is 28th May as World Menstrual Hygiene Day is because the WHO has framed it in such a way. From time immemorial, we always say that 28 days is menstrual, one cycle. So we like 28 Nakshatram, all these lunar months we call, no, pregnancies, actually 28 into 10 months. So it's called lunar month. So 28 days, and the average duration is 2 to 7 days, but mostly people have a 5 days. So it's called 28/5. Every year, 28th May is celebrated as World Menstrual Hygiene Day. Here I'm going to talk about breaking the silence and breaking the stigma. Yes, we need to do that because a lot of negativity, a lot of stigma is there. People are actually very apprehensive to talk about it, to be open about it. I think we have to maintain the sensitivity of the whole matter. At the same time, make sure that people don't have to suffer in silence. So globally, at least 500 million women and girls lack proper access to menstrual hygiene facilities. Data published by the World Bank. According to menstrual hygiene management guidelines published by Ministry of Drinking Water and Sanitation and Government of India, 113 million adolescent girls are particularly vulnerable to the onset of menarche in India. So imagine, every day we see so many girls starting their menarche. The term adolescence is derived from the Latin word adolescere, meaning to grow, to mature, and considered as a transition from childhood and adulthood. So this is exactly what I keep telling the girls. So they come with a lot of, why should I have it? Why doesn't my boy in my class does not have it? So they always compare. So we have to tell them it's a part of growing up. The progression from appearance of secondary sexual characters to sexual and reproductive maturity is a market feature. So the categories, how do we categorize the age group? Early adolescence is 10 to 13 years, the spurt of growth of development of secondary sexual characters. Middle adolescence, 14 to 16 years, separate identity from parents. So they all think they are very mature, they are very independent. It is one of the most difficult age group to deal with, according to me. We call it, the mid-teenagers, real teenagers with lot of, peer influence, lot of influence from the social media, and they think that they are, whatever they are doing is right. Desire for experimentation, it's absolutely true. They just want to venture new things without sometimes understanding the risks involved. So we have to be very careful with them and always tell them that it's better to be safe than sorry. Late adolescents, distinct identity. They want independence for sure, because by 18, here everybody gets a driving license and everybody has the eligibility to vote. So they think they are adults. Well-formed opinion, ideas. Very, very true about this statement, because when you just think of, I myself have two teenagers at home and I know how difficult it is to talk with them something which they have a very prefixed idea about. And they all think we all belong to old Stone Age and new Stone Age, even though we consider ourselves as very contemporary and very Gen Z. Adolescents, defined by the United Nations as those between 10 to 19 years of age, 1.2 billion of world today are adolescents, the real true citizens of the future world. Unless we still instill good discipline, behavior, moral, cultural values, good health. I emphasize good health. In this 1.2 billion, I think the world will be a very, very different place to live in future if they don't take care of themselves and they are not independent and very well brought up. Making up the 16% of the world's population, so which is like quite a huge number. We all say, the 20 to 60 years, the main working population is people who really have to be very strongly grounded to principles and values. About 21% of the Indian population is adolescents, 243 million. That's a huge, huge number. They are our future of a nation, of this world, of this universe, forming a major demographic and economic force. The scenario in India. So definitely 100% feel that there should not be any discussion on the process of menstruation. It just happens. They tell the mother there is some social or religious or cultural functions that are held, and after that it's like when my daily, I mean monthly going on, and if the girl has any problem with periods, she can't even open up, and mother just sometimes says it's okay, you it will become all right. So a lot of times even the abnormalities are not brought out, and they are not taken care of. They are actually kind of ignored. 90% unaware of importance of washing menstrual cloth. 87% use old cloth as menstrual absorbent. 86% completely unprepared. They do not know what if they're traveling, or if they're in a new place, or they're in a school, how to tackle this. 79% have very low self-confidence. They can't understand it's a normal physiological process. It's a part of growing up. So when something like this happens, they just panic. They become very paranoid, and they just say next time, if you tell them, it's going to happen on a regular basis. It's like, you're growing up, your organs are growing up. They don't want it. They upfront, they say, no, I don't want it. I don't want to go through this. 64% felt very scared and panicked. 60% miss school on account of menstruation. They say, I don't want to school. It might stain my undergarments or my dresses. And they don't want to go to school on those days. They don't want to do anything. 47% mothers did not agree with girls knowing about it before its onset. This is actually not the right thing to do, right? Because for mothers themselves, they don't want to talk about it. Leave it on the girls. So the main source of information that they get is from their peers, which is definitely not the right thing to go about, right? They discuss in school all these girly talks. They talk in school. You got it now. They got it now. She got it later. I am going having like this. You are having like this. My mother said that. So it's like when girly discussion, whatever knowledge they have about us between themselves, not the right kind of information that they need to have. 44% felt embarrassed and humiliated over restrictions. They felt imagine somebody, a girl having periods is asked to sit alone and sit outside and not being allowed to mingle with the other member of the family. She is served food separately. She's asked to stay separate for the next 3 days in a separate room. All these things actually creates a lot of inferiority complex and inhibitions among the girls. 33% never washed clothes before using for the first time, and 6% never have heard of sanitary napkins. It's very true in people in tribal areas, in hilly areas, people with low socioeconomic status. Still, these things are normal happening. Now, we all know about the hypothalamo-pituitary ovarian axis. I'm sure Dr. Hemchand is going to discuss in detail about this. But just in an overview, we have this ovarian cycle, the ovarian hormones, estrogen in the first half, the proliferative phase, the progesterone in the second half, the luteal phase, and have the uterine cycle where the shedding of the endometrium happens. The endometrium becomes very thin, it builds, and then it sheds. The cycle keeps on going on a regular basis. What is normal periods? Menstruation is actually it normally begins 2 years after the appearance of first physical signs of puberty. So I leave it to Dr. Hemchand to talk about the signs and how the phases go through. Normally, anywhere between 23 to 39 days. Normal average is 28. Usually, the menstrual blood is not clotted unless it's a very heavy flow. A normal flow is 2 to 7 days, the average being 5 days. The normal girl need to change 3 to 4 times a day a pad, and during the first 2 years it's very irregular, very irregular, and the mother panics, the girl panics, the party panics, the atta panic, everybody panics, and they think something is abnormal. But it's very important for us to reassure them at this stage that it can be irregular, and or most of them outgrow all these things over a period of time. Abnormal irregular menstrual cycle can be commonly due to change in lifestyle, stress, weight loss, weight gain, anemia, and sometimes even most of the time these cycles are anovulatory. And when the hypothalamo-pituitary ovarian axis matures, they can have a normal cycles. So what is PMS? So many girls, many women, even at any age, many people talk about PMS, and they get very angry. There are 3 symptoms which can be physical symptoms, which can be psychological symptoms, and we have behavioral symptoms. So all these things can be put together, and many people call that they are not themselves during the PMS days. And once they get their periods, they just think that they're a completely different person. So a lot of people go through this premenstrual syndromes, which can be easily managed, and we need to do a lot of counseling. There are other therapies, cognitive behavior therapies, there are other hormonal therapies for PMS, and many people do well. It is just that, girls don't have to stigmatize themselves that they are suffering from PMS, and not cut schools or colleges, stop themselves from playing, stop themselves from not doing any of the activities during. So I belong to a running group where we always have the slogan called "Don't pause." We don't pause exercise during periods. Don't pause exercise during pregnancy. Don't pause exercise during menopause. So there is no way that we can get away without doing exercise, because exercise actually increases your brain threshold. And a lot of people, there are few marathon runners who actually would like to time their periods and do major runs during the periods, because they feel very light and fine and happy during running during periods. So don't have to stop any exercise. I know so many sportswomen. If you consider this, all the sportswomen in the country, there are so many sportswomen. They also have normal regular cycles. They also have PMS and all those symptoms, but they overcome with by just getting on to their normal routine, and they cannot take off from their sports training just because they have periods. They cannot take off from their matches just because they have periods. They have to do everything with periods, but they have a lot of good pain coping strategies, hydration, exercise, simple therapies to cope with the pain. So now, when to consider doctor dysmenorrhea if the menstruation is very painful, that's severe enough to limit normal activity and or requires menorrhagia is having heavy flow more than at least more than, I would definitely recommend if they have more than 4 to 5 pads per day and prolonged more than 7 days. If there is discharge that is colored other than the normal color or has strong foul smelling odor or very itchy private parts. Personal hygiene is necessary to prevent reproductive tract infection, local itching and bad odor. Every day, they're very important. Many times they think it's a evil thing and it's a, what do you call, and very bad blood that is coming out. So they are all untouchables. So they are actually asked to live separately. But we tell them that it's just normal endometrium that is shedding, nothing unhealthy or bad about it. So we ask them to be very clean, take bath twice a day, sun-dried clothes and undergarments, wash with soap and water, and definitely they should actually make sure they don't get rashes and all these, even nappy rashes or these fungal infections by regular use of pads and being always wet and moist. So menstrual hygiene, like local infection, should be prevented. And many times they use pads for a long time. They don't drink adequate water. And because they don't have access to bathroom, sometimes they develop urinary tract infections, pelvic inflammatory disease. Very, very important. Because many times these infections are transmitted through gonorrhea, chlamydia, or through the cervical glands, and they can travel upwards to the tubes and cause chronic pelvic pain, tubal blockage, infertility, and chronic pelvic pain is an annoying disease, and PID, pelvic inflammatory disease, and many of them suffer from this chronic disease on a regular basis, which leads to loss of quality of life and economy. So inadequate protection, insufficient water facilities. This is very, very common when we go to really suburban areas and very areas. Sometimes having a good restroom is also a problem. Sometimes the restrooms are not very clean. So girls are very, they don't want to use the restroom because of the fact that they are not very clean. Use of unhygienic materials to absorb menstrual blood cause vaginal infections and long-term effects on the reproductive health. In olden days, the cloth was being used or sanitary napkin, but definitely it should be clean and sun-dried before every reuse. It's better to keep cycling them, at least change the cloths at least once in 2 to 3 months. They can be very soft. They should be using very soft cloth, and definitely shaving is not recommended, because sometimes what happens, they think it's very important to be clean. They keep shaving every month, and sometimes they have a lot of stubbles and folliculitis. So very, very commonly we see staphylococcal infections when people who reckon you shave. It's okay to trim them close, but definitely not very, and sometimes because of the shaving, the skin becomes very, very thick and edematous. And even though the skin and the vulva is very, very sensitive and very fragile. So napkins, definitely we have been using this for time immemorial, and we all know about it. 60% of the urban areas are using sanitary napkins in small and medium towns and very urban areas. Most of them are attending schools and colleges. So only 20% actually are unaware of what it is. Then, and more importantly, about disposal, I think it's very important to use, very sensible to wrap them in a cover and then throw them properly in the dustbin, and not to in the closet and flush it off. That is the reason why when you had the tsunami and Varda cyclones. The most common reason why we had a lot of flooding is because all the water bodies, pipelines have been blocked with the sanitary napkins and plastic covers. Then, NGOs, institutions, and government-supported self-help groups are already in the form of MHM to Ministry of Health and Family Welfare, menstrual hygiene awareness, and production of sanitary napkins. UNICEF is also doing its bit by in the field of sanitation, health, hygiene, capacity, and building. And definitely, we have a lot of NGOs doing this very good job. And disposal, yes, very safe disposal, very sensibly disposing them. Majority of educational institutions, private or government institutions, women-friendly toilets and restrooms. So it can, if it's a common toilet, people are very inhibited. I think it's better to have a separate toilet for women. So wrapping them and disposing them of correctly. And most importantly, we should not be flushing it. And then safety, incineration, main source of disposal of use, how to dispose them. I mean, in the not putting in the big dustbin and everything forms a big pile in the of landfill pollution. So generation of dioxin during incineration can be avoided by adoption of only environment friendly raw materials right at the beginning of manufacturing process. This is very, very important. That is the reason why we have come up with a lot of cloth pads which are actually quite friendly. Even incinerating them will not produce any toxic pollutants. So household place behind the houses are advised to dig pits. Lot of, it's very nice to have a compost in every house. I do composting with the kamba for all this dry and biodegradable, non-degradable waste. These cloth pads also can be, they gently decompose. Soil napkins are collected in broken pots, buckets, and drums kept close to prevent from drag by animals. Burn the napkins collected over a period of time. So not to form a big landfill pollution. Burning sanitary napkins release harmful toxins, posing serious health risks for those proximity. Without proper precautions, this method not only leads to pollution but also leads to serious health hazards. So that is the reason why they use these safe sanitary napkins. Even when they're incinerated, they don't release these dioxins. Safe disposal. And in view of the steep rise in expected demand for them, steps could be taken to train masons for constructions of incinerators, electrical incinerators, prefabricated ferrocement incinerators. And everybody, should be aware of that. These things are available, these things are there, and we just have to make use of them. Next, there's a huge pile of, landfill garbage that, is actually the most difficult thing to digest when when you go to, whenever you pass through Pallikarnai marsh, you'll be very upset, how much of garbage we are producing every day. And look at the amount of landfill space. The Pallikarnai marsh, which was once a good site for these migratory birds, is not just, it's disappearing. I don't know, maybe our next generation might not have the opportunity to see them or enjoy them. Cloth pads are definitely in vogue. A lot of NGOs we have. I myself know quite a lot of NGOs, right? Out of my startup friends of mine who are doing this cloth pads sale. And now coming up the menstrual cup, the most important thing. This is very important even for the doctor community, because a lot of whenever a doctor patient comes to me and asks them about menstrual cup, they themselves say, "Doctor, we are not aware of it." Gynecologists may be aware of it, but a general physician or a pathologist or a microbiologist, still when I talk to them, but they say, "No, doctor, we are not aware of it. We just want to have your guidance regarding that." Menstrual cups are small, flexible, funnel-shaped cup made of rubber or silicone that can be inserted into the vagina or catch and collect the periodic fluid. Cups can hold more blood than the other methods. So very, very eco-friendly alternative tampons. Depending on the flow, can vary up to 12 hours. So smaller cups, it's available in 3 sizes: small, standard, and large. Definitely, a lot of mothers come and ask, "My daughter is just now 18, 20, can she use?" So if the mother is actually okay with the girl using it, I think it's okay. I know a lot of runners, hikers, mountain climbers. So one of my friends who has been to the Everest base camp, there's no choice but to use menstrual cup because water is not very freely available. They can't go and look for places to dispose of this sanitary napkins. So it's quite a very good option, very eco-friendly option. So wash hands thoroughly, apply water or water-based lubricant at the rim of the cup, tightly fold. It's every pamphlet along with the menstrual cup product that we buy gives with the information leaflet and the methodology of how to use it. It's just by practice. It's just a matter of practice. This way, how to pinch it and make it a fold and squeeze it on both sides and then insert it in the vagina so that it snugly fits into the external or so that the entire blood flows into the cup. And then there is a small uh, knob like thing. So they just have to pull it up and then remove it. So removal is actually, there's a small stem like thing, maybe around 2 centimeters or so. So just have to pull it up and the cup completely comes out and they just have to pour it in the closet and then clean the cup nicely and again they can insert it. Once it is out, empty the cup into sink or toilet and they can reuse it. So it is very affordable. So once you buy, we can keep reusing it. It's safer than tampons. Tampons are very, very important, very, very dangerous. If tampons are forgotten and kept for a very long periods, they cause very bad syndrome called as toxic shock syndrome, which is due to staphylococcal infections. So best is to use a cup. Holds more blood than pads or tampons. It is better for environment than pads or tampons and can't be felt during sex. Some brands are very, very soft that, even during periods, people prefer to have sex. They are actually not very, this thing, visible. I mean, they'll be visible, but very soft. Can be bore with an IUD. So even people will ask them to have a copper T inside. And when I remove the cup, won't the copper T thread or something come out? No. So the cup is actually more snugly fitting and the copper T thread hardly 2 centimeters is cut beyond the external loss. So unlikely that the copper T thread, the copper T will come out along with the cup. It can be bit messy, but people, they have to wash hands and they just have to learn to do it. Many may be hard to insert or remove, maybe tough to find the right fit. We just have to do a trial and error. Some people, a small might be right for them for young people who are unmarried, but maybe somebody who has had a normal delivery might be even find it comfortable with a medium or large. Usually it's with silicone, so most of the time there is no allergic reaction. If there is an allergic reaction, they can change try another brand. I have so many of my patients have advised them about cups and not many complain of vaginal irritation, and it's only a short lasting one. So there are other methods like tissue, cloth, cotton, all these things we have to understand if we use this particular thing, how to dispose them off. And there are a lot of practices which needs to actually be eradicated. Unclean sanitary pans and materials, changing plants infrequently. They won't, when they are going out, when they are shopping or something like that, the bathroom is not good, they don't even change. For 8 hours, 10 hours, they use the same pad, same tampon. Then another very important thing is wiping from front to back. So we all know for females, all the three tracts are together, the urethra, the introitus and the anus. So the anus has a lot of rugosity where if they are constipated, if they're not washing their after their defecation properly, the fecal matter can stick to that. All of us have enterococci and E. coli in the fecal matter. So if this enterococci and E. coli, they travel from back to front to the urethra, they cause E. coli, UTI or enterococcus UTI, which is very, very dangerous. So best is, even while wiping for a young girl child, neonate, we ask them to wipe from front to back, throw the wipe and then use another thing again from front to back, not from back to front. Frequent douching. I really see this in a lot of people. They think they just want to be very, very clean and very, very hygienic. So they keep washing the area with water, hot water. They use manjatanir or turmeric water. They use Dettol. They use all corrosive substances which can completely damage the skin and the vulva and vagina. Actually, we live in a beautiful understanding, symbiotic relationship with the good bacteria in the intestines, in the vagina, in the mouth. But in comes to vagina, the pH of the vagina is maintained by the lactic acid, lactobacilli, dauroline bacilli, which is very, very acidic. So when people frequently keep douching, the good bacteria get washed away. And that is the reason why a lot of fungal and bacterial infections are very common in people who think they want to be clean and they keep douching frequently. So that's why it's called as bacterial vaginosis. So the good bacteria goes away and then many bad bacteria come and colonize the vagina, and that is the risk for recurrent bacterial vaginosis. So it is very common, people who keep washing. So best is to just leave it to nature. Wash only with normal water, just dab it dry and keep the area well ventilated. That itself will prevent a lot of infections. My mother used to say, in those days, we never had so many infections. Now, why many girls are complaining of ice? I used to tell them one thing, Amma, you all wore saris and pavardhavani, so we never wore tight leggings, jeans and dry fit clothes. But now it's okay to be very fashion conscious, but not at the cost of our health. That is what is I understand. It's okay to wear all these garments, but when they have an infection, when they have a problem in the irritation in the vulva, I think it's nice to wear loose, well-ventilated clothes. Lack of hygiene practices, improper hand washing and sanitary, changing sanitary towels. That's very, very important. I really cannot overemphasize that. And menstrual absorbent, mostly we recommend menstrual cups or menstrual pads, which are very, very eco-friendly and without pads made without dioxin. And conclusion, sorry for the long presentation. Educating girls, educating parents, educating the society. Menstruation facts, physiological implications, significance, and proper menstrual hygiene practices needed the heart. We have to break the inhibitions about racial beliefs, misconceptions, restrictions without breaking their sentiments. There are people who are very, very sentimental about it, but still we have to explain the scientific basis behind it. Inclusion of sex education, schools, focus group discussions, mass media campaigns can be helpful to overcome the taboo and aspect of menstruation. Mothers should be encouraged to discuss menstruation and menstrual hygiene with the daughters. It actually creates a lot of bonding. So the daughter comes up with any query, she just comes to the mother. Practice is menstrual hygiene, stay safe and stay healthy. And theme for 2025 is period friendly world. I think everybody should have a more period friendly approach to everyone. Thank you so much for your patient listening. Sorry for overshooting my time. Now, thank you so much. Now we'll go on to the next session. I know it's a very basic one, but still we just want to reinforce a few things among our doctor colleagues also. Now I welcome Dr. Hemchand. Dr. Hemchand is a very good friend of mine. He's a pediatric endocrinologist par excellence. And anything in endocrinology, pediatric endocrinology, I approach him. And he's a consultant in the Department of Pediatric Endocrinology and Diabetes at Mehta Hospital, Chennai, consultant Endo Kids Clinic, Chennai, and lot of credits and publications. He has been invited speaker in many, many conferences. His areas of interest are growth charts, growth hormone therapy, and type 1 diabetes. Over to you, Dr. Hemchand.
Thank you, ma'am. And thank you to the Foxy for organizing such a relevant CME on this day. So over the next 10 minutes, what I thought was, I hope my screen is visible and I'm audible.
Yes, yes, sir. Yes, sir. Yes, sir.
What I thought I will share about or 8 to 10 cases quickly, 1 minuters, and what quick tidbit that taught us. So these are probably the learning pearls which we will see at the end. A mother's concern. Uh, a 9-year-old child, will she land up with early menarche? All her classmates, many of them are attaining menarche even at class 5, class 4, class 6. Why? What can I do to prevent this? If you look at data from across our country, there is a lot of data coming from North India, East India, and Western India. And there is a clear shift in the onset and progress of pubertal milestones towards the left. And this shift is more pronounced in those with an elevated BMI. If you look at data, I have put it, you see that with every passing half to one full decade, you can find that there is a shift in the left in the onset of thelarche and onset of menarche. I think it has been reversed here. So the only thing which you can do as a healthy parent is resort to a healthy lifestyle, adequate stress on good nutrition, regular exercise, avoidance of gadgets, maintain a normal BMI, and probably this secular trend can be bucked. 7-year-old child with breast budding, will she land up with early menarche? You know very well, menarche is a culmination of pubertal progress which converts a girl to a woman, and a proper assessment of the Tanner stage. Assessment of the changes of estradiol on the breast tissue staged as 1, 2, 3, 4, 5 based on the morphological changes and the impact of the estrogen on the pubic hair resulting in progress of the pubic hair is very important, and ultimate end is menarche. So girls pass through a phase of thelarche, pubarche, menarche, and in early phases they may also have a growth spurt. So this sequence is very important. So whenever you find signs of early thelarche before the age of onset of 8 years, and you have onset of pubarche before the age of onset of 8 years in girls, be careful. I have a 7-year-old girl. Will she land up with early menarche? She's also growing rapidly. Childhood growth is divided into three phases: infancy, childhood, and pubertal phases, which is predominantly governed by nutrition, basic thyroid and growth hormone, and sex hormone. Whenever you have a crosstalk, the sex hormone comes over to play during the childhood phase. You definitely can have a rapid growth in the childhood phase itself. So rapid growth along with features of sexual maturation may be a harbinger of onset of early menstruation. Whenever you have a child with growth acceleration, you are probably looking at a wolf, and you are finding a child with early maturation without growth acceleration, you are looking at a sheep. This is a 7-year-old child with breast budding. She has grown rapidly, and a large uterus was mentioned in some irrelevant scan that was taken for a different purpose. Whenever you have high estrogenic activity, it not only causes appearance of secondary sexual characteristics, which ultimately lands up in menarche, it also causes a growth spurt, and it also causes an enlargement of the pelvic organs on the ultrasound. So enlarged pelvic organs, large for age, may be a red flag sign and harbinger of onset of menses. So to sum it all up, you have a child who is showing features of early maturation with rapid growth, advancement in bone age, rapid progression and enlarged pelvic organs on ultrasound. You're looking at a rabbit. Slow growth, no bone age acceleration, normal pelvic organ dimensions, no growth spurt. You're looking at a tortoise who might not be a big cause of concern. This is a child with features of early thelarche. Of course, lot of children are entering into puberty early. Should I really worry about this? Why should I consult a doctor? Why should I evaluate? Why should I do blood tests? It may be normal. I am not very keen on interfering with this. Well, children who have rapidly progressive onset of early sexual maturation may be a harbinger of an intracranial pathology like craniopharyngioma, etc. Hence, performance of an MRI in children with true central precocious puberty may pick up lesions which may have to be intervened by a neurosurgeon. It may be a tip of the iceberg. The thelarche and the menses, what you see, early menses, what you see, may be a tip of the iceberg, and you may find a deep iceberg of an intracranial pathology sitting inside. So be careful. That's point number 5. My 8-year-old child has cyclical bleed, rapid growth, breast budding, but no pubarche. Dysynchronous puberty. Whenever you have true pubertal progress, you have good onset of breast development, good progress in the breast development, followed by pubic hair development, culminating with menarche. Whenever you have menarche that is occurring without thelarche or early in the phase of thelarche without pubarche, you are looking at a dysynchronous progress in the puberty, which should be looked into carefully. This may be a sign of a peripheral precocious puberty. It may be because of exogenous estrogenic exposure, onset of menses without any other sign of sexual maturation may be related to local causes, which we should be careful about. It may be a harbinger of a bleeding diathesis as well. So a coagulation profile may be required, or it might be just a normal variant. Increased sensitivity of the tissues, of the uterine tissues to the normal estrogen levels. So whenever you have dysynchronous pubertal progress culminating with menarche without other features or very minimal other features, always keep in mind atypical causes like a bleeding problem, exogenous causes, peripheral causes, etc. My 8-year-old child has onset of bleed, but there is no growth. Child is very, very, very short. I think whenever you have rapid progress resulting in early menarche, but no pubic hair, no growth spurt, you are looking at hypothyroidism. Precocious puberty with short stature is hypothyroidism till proved otherwise. Simple thyroxine replacement can lead to a good growth catch-up as well as resolution of the menarchal process. So the learning point is menarche, menses without growth spurt with very short stature, always keep in mind hypothyroidism. The second last case, precocious puberty with developmental delay. The child is 10 and a half, child is 11 years. This cannot be labeled as precocious, but should we treat her? The mental age is only 2 years. So will she cope up if this child lands up with menarche so early, though she is chronologically 10 and a half, she is mentally only 2 years? In such cases, I think an individualized approach, a cautious approach has to be kept in mind in children with developmental issues, and the mental age has to be factored in tackling of the onset of menarche. And lastly, my child is a 9.5 years, has a first menstrual bleed, was an 800-gram baby. She has entered into menses. She is menstruating, but she is only 125. What next? Will she grow? Well, this is lot of data has been looked into on babies who are born SGA, who tend to enter into puberty early, who tend to progress through puberty rapidly, who do not have a good growth spurt, and they land up as very short adults. So combined growth hormone and GnRH analog treatment, you give growth hormone to boost the growth and you give puberty blocking agents and prolong the years of growth. There is a good addition to the final height. So always keep in mind children with small for gestational age, slow birth weight babies and entering into puberty, you need an extra eye to look into this. So with these 10 cases, what I thought we learn is children are tending towards early menses. We should be sensitized to that, and a healthy lifestyle, good nutrition, regular exercise, and cut down of screen time is the way to probably halt the shift to the left. A proper SMR assessment is very important when they raise the concern early. Proper plotting of growth chart and growth acceleration may be a pointer to the ultimate event of early menarche. An ultrasound may be a simple screening tool to identify this concept. Early menarche, early puberty may be a sign of intracranial pathology. Don't ignore it. Whenever the pubertal progress is discrepant and dissynchronous to convention, be careful. Normal variants, always keep that in mind, and remember menarche may be the sign of the first sign of a bleeding disorder. Early menarche without growth acceleration is hypothyroidism till proved otherwise. Menses in children with disabilities and early menses in babies who are born small for gestational age should be viewed with a lot of caution, and a different strategy has to be adopted in these babies. So I thought these are some 10 points which I thought I should share in the 10 minutes about the relevance of growth, physiology of growth in the various aspects of menstruation. Thank you very much.
Thank you very much, Hemchan sir. I think it's a huge eye opener for us. We all actually, even though we practice gynecology, pediatric gynecology, and adolescent gynecology, I think sometimes it's very important to understand the technical aspects properly so that you know, and when to refer to the specialist, super specialist. So we may have overseen a lot of things, but we thought many of them they'll outgrow certain things. But I think it's very important to understand that every phase is given equal importance, and you have actually given all the 10 cases were very, very relevant to our clinical practice. And thank you so much. If you can, in 10 minutes, this is a very big eye opener. And in a nutshell, what you want to convey, you have conveyed it so beautifully and so explicitly. Thank you so much, Dr. Hemchand. Thank you very much for joining. Just stay back for the few questions at the end. Now I welcome Dr. Lakshmi Prashant. Dr. Lakshmi CV, please. Dr. Lakshmi Prashant is a pediatrician. She's an MD from AIIMS, New Delhi. And at present, she has a clinic in Gopalapuram and also working in Kaveri Hospital and Isabel Hospital. And she is an executive board member of Indian Academy of Pediatrics, Chennai chapter branch, and editorial board member of IJPP. And she is going to tell us from a pediatrician's perspective of how to go about this puberty and menarche. Over to you, Lakshmi.
I'll just start sharing my screen. One second.
Yes.
Just a second.
Yeah.
Is my screen visible? Am I audible?
Yes. Yeah, make it full screen. Yes.
Yes. So I think after a wonderful presentation by Hemchand sir, who is my go-to person for endocrinology referrals, I think it will be a step down listening to me, because I'm going to talk only about simple things from a humble pediatrician's perspective. See, pediatricians, we are all about monitoring, the growth and development right from birth to adolescence. And we focus mainly on both physical and functional changes. Now, puberty and menstruation are two key milestones in this continuum. And we encounter a lot of case scenarios. Let's see this. So a 12-year-old girl presents for a routine checkup, and she began to have breast budding development at 10, pubic hair at 11. She got her first period at 12. Her growth chart also shows a recent height spurt. So what is, my take on it? Yes, this is a typical sequence and timing of pubertal milestones. So we've heard Hemchand sir speak about the progression of puberty. So in this scenario, what do? We simply reassure the family that variability is normal. Just let's monitor for regular progression through Tanner stages and menstrual cycles. Here's yet another scenario. So a 13-year-old girl, she has started menstruating 10 months ago. Her cycles are irregular and she sometimes skips 1 or 2 months. So what is my perspective? What do we need to tell the parent in this scenario? Irregular cycles are so common in the first, 2 years after menarche as the hypothalamic pituitary ovarian axis matures. So we advise tracking of cycles and we provide education on what to expect. When do we further evaluate in this scenario? Only if the irregularity persists beyond the usual timelines, it is associated with heavy bleeding or other red flag symptoms. So we'll just come to that. Now, here's yet another case scenario. This is similar to the pathological ones which Hemchand sir spoke about. So, had a 7-year-old girl with breast development and rapid height gain over the last 6 months. So when we, when the pediatrician, when we plotted her anthropometric parameters on the growth charts, we realized that her height age was more than the weight age, which was more than the chronological age. She was Tanner stage 2 for breast development and pubic hair. Her BMI on, again, the IAP 2015 growth chart was more than 27 adult equivalent, meaning, she comes under obesity. Her bone age was also more than the chronological age. So here we have early onset of secondary sexual characteristics with an advanced bone age and accelerated somatic growth as well. So this should point towards precocious puberty. Why? Because this has happened below 8 years of age. So in this scenario, we need to, one, refer to the endocrinologist, do complete hormonal workup and MRI in one of the scenarios what he mentioned, where you have craniopharyngiomas causing central precocious puberty. Why early diagnosis and treatment are important? One, to prevent early epiphyseal closure, compromised adult height, and we also need to address the psychosocial impacts of this. So we have 3 different case scenarios. Now, how do we become adept at identifying what is a normal pattern and what is a deviant pattern? So the first is we go back to the basics and we try to understand the hypothalamic pituitary gonadal axis, which has been spoken about by both Dr. Karpagammal and Dr. Hemchand. Again, a repeat of what they all said. Yes, puberty is a critical developmental period. It marks the transition from childhood to adulthood. It involves physical, psychological, cognitive changes. And again, this axis, this is in play. See, hormonal changes precede physical changes. That is one thing we need to understand in the basics. This nocturnal GnRH pulsatility precedes phenotypic changes. Okay, this is something we need to remember. And also we need to remember that, the tempo of this hormonal axis, is different in the pre-pubertal age. There is a pre-pubertal hypothalamic pituitary gonadal adrenal axis tempo. There is a classic pubertal and post-pubertal hypothalamic pituitary gonadal axis tempo. So this is something that we need to understand. And of course, the terms and events, everybody has spoken about it, and I'll take it for granted that we are familiar with all these terms. The thelarchy, the development of the breast bud, pubarchy, the development of pubic and axillary hair, menarche, the first menstrual period, adrenarchy, secondary to the secretion of, the androgens, which are responsible for body odor, acne, the development of pubic axillary hair. Now, this hormonal crescendo, where does it culminate? So we have stated several times that there is rapid growth, there is development of secondary sexual characteristics, there is the onset of menstrual cycles, menarche, the key milestone in female puberty, typically occurring between ages 9 to 15 with an average around 12 years. See, earlier, pediatricians, we used to restrict ourselves to say, 13 years or 15 years. Even now in ICH, there is an admission criteria age-wise, restriction of admission criteria age-wise. But ever since the WHO revised the definition of adolescence from 10 to 19 years, we have also expanded our spectrum of care, and we have become comfortable handling, the other end of the age group as well, the higher ages with the heavily built individuals. A contrast to the low birth weight SGA that we are usually comfortable seeing. So yes, the onus is now on the pediatricians to be the pillar of support during this crucial period of growth. So pediatric view, understanding puberty. So obviously, as I said, we need to know what is normal so that we will be able to do what we are supposed to do. The core of pediatric practice, the heart of pediatric practice is growth, nutrition, developmental assessment, immunization. Pediatricians, we are just all about anticipatory guidance. So in a way, we are similar to, the gynecologists, the obstetricians, who advocate women's health that way. And professional bodies like the AAP and the Indian Academy of Pediatrics, they have put forth guidelines as to how often monitoring of such crucial indices needs to be done. Like, for example, see, here is the table that I have quoted, and it is so clear that in children more than 5 years, we have to stringently document height, weight, and BMI every 6 months until 9 years, and then annually thereafter. And we also need to document the Tanner's SMR every year. So this is how much we prioritize anthropometric measurements. Again, remember, we have to interpret SMR in tandem with the growth parameters and not in isolation, especially when it comes to disordered puberty or disordered menstruation. So yes, these are the growth charts. Pediatricians, we are very familiar with this. Currently, we are using the 2015 WHO growth charts and the pediatrician friendly charts. Now, a simple growth chart gives us so many inputs. For instance, look at this growth chart. From these two charts, we can identify underweight, overweight, short stature, and in degrees of short stature, as in stunting, severe stunting. So you can identify moderate acute malnutrition from your weight for height charts, severe acute malnutrition from your weight for height charts. We have BMI charts separately where we can identify overweight and obese children. So as I said, these growth charts are important tools that we use in our office practice. And of course, Hemchand sir has spoken about the Tanner's SMR, the stages of Tanner's, the 5 stages. We're all familiar with this, so I'll just skip and move on. So this is something that we need to know what is normal. So the right timeline, the right progression, and culminating in the right event. So the right timeline, ages 8 to 13 years in boys and 9 to 4 in girls, sorry, and 9 to 14 years in boys. Girls are probably a year earlier. There is a gradual and consistent progression through the Tanner's stages. So there is a right sequence. So you have breast budding, and then, in the next 2 to 2.5 years, you can expect menstrual cycles. There is a gradual progression. And any dysynchrony, as sir said, all your red flags, you should get alerted. And finally, a predictable sequence of development, again, thelarchy, pubarchy, the growth spurt, and menarche. So if you look at timelines, I've already spoken about when the onset happens, what the sequence of events are, and why it is important to use the Tanner's staging to objectively assess and document pubertal progression. So the clinical note for pediatricians, simply based on your growth charts and your SMR. Early or delayed onset requires evaluation for underlying pathology. Okay, on the side, you have a very wonderful timeline, which just shows, the age ranges, from where breast budding can start and develop, when pubic hair, the development can start. And, there's a window. This is similar to our Trivandrum developmental screening chart. So, a lot of charts we use in pediatrics. So pretty much there's a lower limit, there is an upper limit of normal as well. So this is a very good timeline that we can remember. And when to refer. Of course, when there are red flags, when there is premature appearance of secondary sexual characters, girls with axillary pubic hair growth or breast budding before 8 years, and boys with the same before 9 years. Again, the other extreme also we need to remember, delayed. Girls with no breast budding by 14 years or no menarche by 15 years, and boys with no signs of puberty by 16 years. Arrest at the same stage of puberty. Non-progression, nothing ever happens for more than 2 years. This is when we refer. This is regarding, the onset of puberty, the onset of pubertal signs, when to refer. Now, let's say we have a normal child who has attained puberty at, the normal age. Menstrual cycles have started in the normal time frame. So now, what to expect? So again, the average age, 12 to 13 years. The normal range is 10 to 15 years. We are seeing children a little earlier than usual. We need to understand that the initial cycles are often anovulatory and irregular for up to 2 years. They can have mild cramps, mood changes, breast tenderness associated with the initial cycles. Clinical note to pediatricians. Heavy, painful, absent periods warrant further assessment for disorders such as coagulopathies or endocrine dysfunction. Again, interpret along with your growth parameters as well. Now, patterns and variability. The cycle length can, be anywhere between 21 to 45 days in early adolescence. Again, a repeat of what I said, up to 2 years to regularize. Remember, this is accepted as normal. Irregular cycles, variable flow, and mild dysmenorrhea. These are acceptable initially. Note to pediatricians again. When do we investigate? When there is persistent irregularity, when there is amenorrhea more than 3 months or excessive bleeding, we need to investigate. As Dr. Hemchand sir said, many a times a bleeding disorder or coagulopathy, the initial manifestation can just be menorrhagia. So, the American Academy of Pediatrics says that menarche is just as important as any other vital sign. Yes, in office practice, this is true because menarche is a hallmark of female puberty. It signifies endometrial cycling and ovulatory capacity, so much so that you can take it as an indicator of overall health and a surrogate indicator of endocrine function. Abnormalities in menstrual patterns can signal underlying health issues, hormonal disorders, chronic illnesses, systemic disorders, everything. You name it, you have it. So it is important to assess periodically. Regularly inquire about menstrual cycles as a part of routine pediatric and adolescent visits. And remember the red flags. So as pediatricians, what role do we play? So education and support, here's where we come in. We have to provide age-appropriate explanations about puberty and menstruation to patients and families. Now, what is the right age to talk about this? So, this question is like, what is the right age to have a child? It is something like that. Nowadays, I think the right age is around 8 years. When children are curious, they become more exploratory and they start asking questions about, they start noticing changes in bodies, body conformations, physical characteristics. So it would be a good idea to start talking, say, at around 8 years, just like how we speak about good touch, bad touch very early on. So we need to speak to the children and the girls and the families about this. And support in terms of creating a welcoming, non-judgmental environment where you're free to ask questions, address anxieties and dispel myths, bust a lot of myths, a few have been spoken about by Garpagambal ma'am. Period blood is not impure blood. Periods are supposed to be painful. That is really, really wrong. And you're just not supposed to do anything during your periods. You just have to sit and eat. So all these myths need to be busted. And clinical assessment, of course, we cannot but help stress this over and over again. It may look repetitive, but Hemchand sir said it. Here I am saying it again. We use growth charts, Tanner staging, and menstrual history as routine tools, and we work closely with endocrinologists and gynecologists for complex cases and multidisciplinary care. So yes, the onus is on all of us. We have a responsibility to our children, and we have means to make this easy also. We have a lot of comic books that have been designed for children where they can read about what happens during puberty. The brothers in the family also must read about this comic so they actually know what their sisters, their mothers, their aunts are going through. I think with that, I would like to end my presentation, and I'm very grateful to the organization for giving me this opportunity. And I hope I've done justice to what was asked.
Definitely. Thank you so much, Lakshmi. It was really very nice. And I just cannot overemphasize being non-judgmental, being open, and educating the boys as well. The more we hide from them, I think they become more curious and start searching the social media and other learn irrelevant information, and I would call it a misinformation, and they get carried away. I think it's better to be open to them and tell them this is what it is, and it's nice. If you won't have any doubts, anything, please ask us. The more we hide, the more we do it stealthily, they start doubting us and they want to learn more in their own way. So now I thank you so much, Lakshmi. It was really a very nice presentation. And now over to Shubhashri ma'am. Shubhashri ma'am is a biology teacher from Vidya Mandir. She teaches for class 6 to class 10, and she has to say a few words, and then she has few questions to us as doctors, and she wants to know how to go about these things, certain things from her perspective when she encounters or when she comes across such situations in schools and also as a parent. Welcome, Shubhashri Kalyanaraman ma'am. Over to you, ma'am. Shubhashri ma'am, you can unmute, ma'am. You're muted.
Oh,
Shubhashri,
I'm sorry. I'm sorry. I had that. I had to. I was out of the meeting and I had to sign in again. I'm sorry about it. First of all, thank you very much for having me. It was an eye opener. I didn't know I was this ignorant until I joined meeting. That's quite embarrassing for a teacher. But it's a lot of the questions I had in my mind actually was answered during the course of the talk, the webinar, which was also excellent because it will save quite a bit of time there. My first question was going to be about children starting periods earlier on and when to start educating them. I got answers for both of those questions from the two speakers already. That's wonderful. I have one more question to add to it. Like I myself, I'm a mother of two sons. I don't have daughters, but I have a lot of daughters at school as my students. But about boys, they are they're very, very curious. And I know a doctor mentioned that we start educating girls at age 8. Would that be a right time to start educating our boys too?
Dr. Lakshmi, would you like to take up the question? Lakshmi?
Yes, ma'am, absolutely. See, maybe I should have been clearer. I think the right 8 years is a reasonable age now to talk about puberty to both boys and girls. Because as you rightly said, curiosity doesn't have an age, doesn't have a gender bias. So boys are just as curious. So it is a good idea, just as we talk to them about good touch, bad touch when they are young. We will have to start talking to both boys and girls around 8 years, and again speak to boys about how they also undergo physical changes. We need to talk to them about the hair in the armpits, the hair in the privates, how the size of the penis is going to increase, how everything. So everything you need to talk to them Obviously, there are, differences in the two, obviously anatomical differences. So we will have to talk to them around that age. I think it is okay to talk to them too, ma'am. We should normalize talking to them. I think if there's one thing that all doctors in this forum would like to get across will be, let's just normalize talking about this rather than speaking about this in hushed tones. If we fall ill, we are okay to say loud and proud that, oh, I got the flu, I got COVID, I got admitted, and, we are okay to talk about all this outside, our ill health, we are okay to talk about all this. This is a normal part of growing up. I think we should break that taboo and be okay talking about this loudly.
Okay, thank you. Thank you so much. The next question, I'm going to jump all the way to menopause. Myself and a lot of my colleagues are somewhere there. And there's a general belief that with menopause, after menopause, all the joint pain and starts, and there's a general deterioration in health. Is that true, or is it because of the coincidence? We are aging after 50 anyway, or everything else starts turning south? Is it that, or is there something that we can do about it?
Okay, I think being a gynecologist, I would like to take up this question. Ma'am, actually, menopause is not a disease. It's a passing phase. There are certain metabolic changes, hormonal changes that happen during menopause. But definitely menopause does not lead to ill health, ma'am, because there are still many people who come to me and say, doctor, I got diabetes after menopause. I got hypertension after menopause. No, actually, there are a lot of people who are diabetics and hypertensive who are still menstruating. We have so many pregnant women who are diabetics, who had regular periods and still they became pregnant, and became a diabetic. So metabolic diseases are actually a part of our regular, inheritance, because being born in a Southeast Asian country, we're ethnically, geographically prone to metabolic diseases. And what happens in the Caucasian countries, we are a decade ahead. So if something happens at 60, we are like, the metabolic disorders can happen to us at early 50s or late 40s also. So what I would like to tell you is the ill health that is thought after menopause actually should be taken away. We know so many people who are actually quite active after menopause. My grandmother lived till 90 years. She delivered 12 children. And another grandmother delivered 8 children, still lived till, I think, 84 years or something. So menopause does not actually damages anybody's health. The only thing that we are concerned about is the loss of hormones that actually happens very slowly. For some, it happens suddenly when they have a surgical menopause. The menopausal symptoms like hot flashes, night mood swings, night sweats, everything. And osteoporosis, very, very important. We are worried about osteoporosis because estrogen is a very, very important hormone for bone strength. That's very concerning. People, so I recommend good strength training exercises and definitely a calcium supplementation to menopause. And the other thing is cardiac. Estrogen is supposed to be lipid friendly. But if you see the number of men and women having cardiac problems between the age of 40 to 50, 50 to 60, 60 to 70, actually 40 less than 50, the men really outnumber women in large numbers, by large numbers. 50 to 60, it depends on factors like menopause. Menopausal women are definitely at risk of cardiac problems. The metabolic problems like diabetes, hypertension compounds it. So it accelerates it. And after 60, after menopause, I think the risk is almost same. Maybe men have same, there are more diabetics and everything. So, I mean, I strongly believe that menopause is a natural process. And I think we can always, don't have to be, feeling bad about it. We have this arthritis problem because of menopause, this knee pain because back pain because of menopause. Just imagine so many men having back pain and problems with after having working in this IT sector for many years. It's just the general health that needs to be improved on overall whole. And menopausal symptoms, if there are any difficulties, menopausal symptoms, abnormal uterine bleeding before around menopause, those can be sorted out definitely medically. So I don't want anybody to consider menopause as a disease. We don't consider menac as a disease. We don't consider pregnancy as a disease. For us, still pregnancy is a normal physiological process. Only thing, there are a few low risk and high risk factors which we need to be taken care of. And also menopause, which is definitely not a disease. People have been going through menopause for many generations, and it has been a cakewalk for them. But now we are able to address the symptoms and signs more clearly, have more scientific knowledge behind it, and address them to tailor-made treatment. Hope I answers your question, ma'am.
Yes, yes, very much did. Thank you, madam. Do we have time for one more question?
Yes.
Yeah, this is about my children in class. There are a few who you did address about this in your presentation about painful periods, and a lot of children like have to take the day off school during that time. Um, uh, we try to be sensitive, and we do understand. As a woman, I understand myself, but it's very impractical. And you said all day we shouldn't pause, and stuck very much. And but can we do something to ease it out? There are some exercise that can make it easier for them, or anything that they can do to make it easier in what they're going through now.
Yeah, see, I mean, as being a gynecologist and having a daughter at home, I mean, what I would tell them is just to carry on with the normal activity during that time. Hydration, make sure that they drink lots of liquids, buttermilk, juice, and I mean, have plenty of hydration. And more importantly, they actually, if they are out of the house, if you ask them to do what they are passionate about, they will be fine. I'm not ignoring their pain, definitely not ignoring their pain or not ignoring their symptomatologies. I'm not telling them, nothing, you're absolutely fine. No, everybody passes through these phases. It's very sensitive because when the problem comes, I mean, me being a gynecologist, I am very clear about certain things with my daughter. But when she compares herself with the other parents, how the other parents deal with it, she is not happy about. So what I tell her, it's okay. Everybody deals with it differently. Everybody has a different pain threshold. So mild exercise really helps. It really helps. So ask them to just listen to good music and have a good walk, or go home and play around for 1 hour somewhere else. Hydration. Maybe they can go out with the friends for some time, and not taking off for 2 to 3 days per month. Definitely no school or no hospital, or I mean no college or no institution will agree to that. So they will have to learn to cope up with these things by simple measures. Still, if there are no other major problems and still they are not able to bear the pain, or if they have an important assignment that day, maybe a mild painkiller can suffice. A lot of people actually, I ask them to lie down on the tummy. I ask them, many use hot packs, but I tell them hot packs I'm not very comfortable, because I still remember a girl coming with a very hot bag on her tummy, and she came with skin abrasions. Skin was completely scalds. So I told, please don't put such hot packs on a very friable skin, thin skin, like a young child skin. So I told the mother not to use hot packs. Sometimes for back pain, I ask them to use a lot of cold packs. So cold packs, I tell them, and I ask them to have ice creams because they like them. Many children like ice creams and chocolates. And if they tell them, it's like, giving them a reward or something. So they have ice creams, and like the butterfly squats. So for some reason, the butterfly squats actually stretches the pelvis and relieves the pain to a certain extent. So everybody actually tries out a different methodology, and there is no hard and fast approach to this. Over a period of time, they themselves learn to cope up with the pain, ma'am, and definitely exercise helps. We don't stop our strength training or exercises or running during periods. I'm sure all the sportswomen in this world can't afford to do that. So if they are professional sportswomen, they are supposed to do everything what they are doing even during their periods. Maybe they may do it at a lower profile, not the typical 6 hours. Maybe they can do it for a few hours, so that they don't completely stop for 3 days. Hope that answers the question, ma'am.
Very much. Thank you. I had a connection issue, so I wasn't able to get all of your answers. I did catch most of it. I realize it's being recorded, so it'd be great if you share it later.
Sure.
Yeah. That's about it, madam. The rest of my questions were answered during the course of the webinar. Thank you very much.
Yeah, so there is one question in the chat box. Does earlier knowledge lead to inquisitive nosiness about other sex classmates in school? Lakshmi, would you like to take up this question from Dr.
Yes,
Tara?
ma'am. Yeah, thank you, Tara ma'am, for the question. I think very smart question. See, providing age-appropriate information about puberty and development is considered beneficial, because our children are going to understand and normalize changes in themselves and others. So it is supposed to reduce anxiety and confusion. But there is no evidence that earlier knowledge about puberty or sexual development leads directly to inappropriate curiosity or nosiness. So if we had to look at, between early puberty and early education about puberty, our research shows that early puberty itself can increase the risk of certain behaviors, but this is more about emotional and social challenges rather than simple inquisitiveness. So earlier knowledge, early puberty can make children more vulnerable, but it's not the same thing as being nosy about classmates of the other sex. I think that is okay. So again, open communication, parental support, so important to guide children through these developmental stages.
Yeah. Thank you so much, Lakshmi. And I think it's really an eye-opener for all of us, because we know this, what are the endocrinology behind it, what is normal, what is abnormal. But to understand from an endocrinologist's perspective, from a pediatrician's perspective, and from a teacher or a parent's perspective, how they would like to deal with it on a day-to-day basis. Because when many of the girls, they start their periods in school for some reason, or when they are on a vacation, when you are completely unprepared or unarmed. So it's nice for them also to learn how to deal with it in a non-home environment. And thank you so much, Dr. Hemchand, Dr. Lakshmi, and Shubhashri ma'am for joining. I think, this World Menstrual Hygiene Day, as WHO has designed, we have to consider more period friendly. The more friendly we become, we actually dispel all the negativity behind it and teach our children to live happily in harmony with our own hormones and not to think negatively. That's what I tell about menopause. Please, until unless we start loving our own hormones, and the main reason for why people tell doctor hormone imbalance, always hormone imbalance. PCOS hormone imbalance, menopause hormone imbalance. Why? We are very balanced. Most of the time we seem very balanced only. So there are mild, subtle variations which can always overcome. So let us just take away this negativity about hormones and menopause. Please don't think we have to love our hormones. We are what we are only because of our hormones. So I really want all women to start loving their hormones and live happily ever after with our own hormones. And pregnancy is a state where we had the maximum hormones in our system. And we all breeze through it so beautifully, isn't it? So then why again keep blaming the hormones, excess, less, everything? So that is my take on concluding remarks about hormones. Thank you so much, everyone. It's an excellent session, and I really thoroughly enjoyed the company of multidisciplinary care from endocrinologists, from pediatricians, from a teacher, a parent, and all the participants. Thank you so much for joining. Wish you all a happy evening. Thank you so much. Thanks.
Thank you, ma'am.
Just 1 second. You can all switch on your videos. I'll take a quick picture. Quick picture. Thank you so much. Thank you. Thank you. Thanks for joining.
Thank you, ma'am.
Thank you. Thank you. Thank you so much, everyone.
Thank you, ma'am. Thank you.
Thank you.
Thank you, ma'am.